if you were to sprain your ankle, you're going to undergo a normal reaction to that ankle sprain. A lot of people with low back pain will get better on their own in 6 weeks. You sprain your ankle, a lot of times it gets better on its own within 6 weeks. Because ligaments and tendons do not have a good blood supply, there's only a certain amount of healing that they can do. And with prolotherapy, we're re-stimulating that normal inflammatory response, trying to achieve the goal of full function without pain.
My next guest is a board-certified family medicine physician. He is the founder of Revolution Health and Wellness, which focuses on functional medicine geared towards optimizing the health of their patients. Dr. Chad Edwards, thanks for coming on, man.
Hey, man, thanks for having me. I'm excited to be here.
It's going to be a fun one. I was looking over your site, and there's some topics we've never uncharted territory on this show. So I'm excited to get into some IV therapy and prolotherapy and skincare routines. But before we get into that, I'm curious how you got into being the guy into all that stuff. What was your journey like?
Yeah, so I was an exercise physiology major in college. I worked with a lot of soldiers. I was an enlisted guy in the Army, and then I went to medical school. Did my residency at Fort Bragg, North Carolina, and had kind of a traditional training in that regard. Got out of residency and went to 5th Special Forces Group. And when I was there, one of my commanders who worked in another special operations unit, he came to me and said, "Hey, I need prolotherapy." I was like, "Well, I have no idea what that is." And of course, when your commander comes and says, "I need something," and your job is to go find it. So I started looking into prolotherapy, and actually my PA at the time started looking into it. And we found a guy in Nashville that did prolotherapy, and he fixed my commander's elbow. And he came up and did an in-service exam and was talking about what prolotherapy is, what it does, how it works. And this guy just turned my entire world on its head. He said, I was an athletic trainer in college. I was, a medic and, as an enlisted guy. And I had T-shirts that said, "Just ice it." And this guy said, whatever you do, don't ice, after an injury, and certainly don't use anti-inflammatories. And it turned everything upside down. And I was like, this guy's either crazy or brilliant. And it took me 6 months, but I figured out he's onto something, and I was able to fix things that I hadn't been able to address before in any other way previously.
Don't ice it. Use prolotherapy, or what did he say? Don't ice it, and
anti-inflammatories like Motrin, Naproxen, those kinds of things.
Okay. And so you started seeing this alternative method of reducing inflammation or joint pains or back issues, and you started going down that path. And that's
exactly. And some of the issues that I had dealt with in the past, plantar fasciitis, shin splints. There's a lot of things that we didn't have good results in it. I'd send them to physical therapy, and they may get a little bit better. It may help a little bit, but there was a lot of patients that it just didn't. It was very frustrating. And when I saw
rubbing the Gatorade cup into the shin splints.
Exactly.
Yeah.
Exactly. So, with prolotherapy, I was able to turn that around in a way that I hadn't been able to previously, and it was shocking.
Huh. Okay. And so now, before we start getting into that, you're doing a functional medicine practice, working with the everyday person. So describe the everyday person who's coming in and that you're working with.
Probably the most common, from a functional medicine perspective, probably the most common patient that I see is a female, we'll say 30 to 45, 50, 55 years old, that comes in and says, "I feel bad, I'm tired, I'm fatigued, I have no sex drive. I've been to 3 different doctors. Nobody can figure out what's going on, and there's something wrong. I'm not crazy. I'm not depressed. So figure that out." And that's probably our most typical functional medicine patient. Then we get males that need testosterone replacement, those kinds of things. That would be the typical patient. From a prolotherapy perspective, it can run the gamut. They may be athletes. They may be older patients with chronic pain. That there is no typical in regards to that.
I had a teacher in college, or professor, and he was talking about this one student who gave up and gave a public speech, and he was on the WASL, which stood for like the Washington State Board Association or something ridiculous, right. But no one knew what it meant because he never defined it. So every time he said WASL, it got funnier and funnier and funnier.
Yeah.
So I don't want prolotherapy to be that thing because I don't know anything about it. It's starting to sound like the WASL to me. Can you kind of explain to me what prolotherapy is all about?
Absolutely. And prolotherapy, the term was coined by Dr. George Hackett in the 1950s. when he wrote his book on prolotherapy. So this has been around for a long time, and it stands for proliferative therapy. So basically, we know that ligaments and tendons are made of collagen. So, it's like a steel cable that holds two things together. And the collagen is like the strands of it's the little strands in that steel cable. So when you have damage to one of these ligaments and tendons, prolotherapy proliferates new collagen formation. So we can actually restore the ligaments and tendons to their normal, healthy structure and function.
Okay. Sorry, what does prolotherapy do one more time? I blanked when you were talking about that.
Fine. So basically what you're doing with prolotherapy is you're stimulating your body to heal itself. That's it.
Okay.
And it does that through inflammation. We all think that inflammation is bad, but inflammation in the acute phase is actually how your body's it's how it heals. That is the mechanism by which we heal. Without inflammation, you don't heal. That's why you shouldn't take anti-inflammatories after an acute injury. So very interesting paradigm shift in the way we treat these musculoskeletal conditions. So we're just stimulating your body to heal itself.
And how do you stimulate it? How do you, like, I come into you with shin splints, what do we do?
Yeah, so first we're going to do an evaluation. We're going to try and identify the areas that are causing problems. And I usually it's by palpation. I'm just pushing and poking. When ligaments and tendons are very sensitive, they've got a lot of nerve fibers in them. When they're damaged, it irritates the nerves, and that sends a signal to the brain, causes pain. It causes a whole host of potential symptoms. Pain's one of them.
That's why the guys with the shoulder injuries can't bench press and it hurts.
Exactly.
Or the pitchers throwing the ball over and over again.
Right. Exactly. And we see a lot of shoulder injuries. In fact, it's our number one area that we do, and our success rate is well in excess of 98%. It's amazing.
Prolotherapy, I'm coming to you with shin splints. How would you go about fixing that? You mentioned addressing the problem, seeing what's going on, and then what?
Yeah. Sure. So we're going to do an evaluation, physical exam. I'm going to push on those things. The nerves that live within ligaments and tendons are very sensitive, and when the ligaments and tendons are damaged, causes pain. Sometimes it feels weak. Sometimes you may feel like a kind of a numbness or a weird feeling like that. But a lot of times it's pain. So when I push on those things, then they'll be sensitive. So that helps me identify the areas that we need to treat. And then we perform the prolotherapy procedure, which are injections. And I use a dextrose prolotherapy, standard dextrose prolotherapy solution. Very, very, very safe solution to use. In fact, you almost can't, as long as you understand how to do the injections, you really can't screw it up. It's very, very safe. And so we'll inject all of these areas. There's a little bit of lidocaine in the solution. So the lidocaine helps numb those areas up. And when they're numb and the patient doesn't have pain anymore, I know we've gotten the right area. So I'll have them get up and walk around. If that looks good, then we've gotten the right area, and then we're going to follow them and see how they do.
Okay. So when someone hears injection, they're picturing like a syringe this big filled with all sorts of chemicals. What's in the actual mixture of the prolotherapy?
Yeah, very, very basic solution. I use 15% dextrose, which is sugar, water, sterile water, and lidocaine. Lidocaine obviously is the anesthetic. That helps me understand what areas that I need to get and if I've gotten the right areas and completely and adequately treated the area. The dextrose, because of the concentration that we are using in this injection, it causes a fluid shift. So the fluids will shift out of the cells, and it causes what we call crenation. Those cells in those tissues will shrink, and that shrinking stimulates the inflammatory process.
Okay. What was the libosome? What was that solution in the actual prolotherapy?
Lidocaine.
Lidocaine. Okay. Yeah. And what is that made up of?
That's just the local anesthetic. So if you're going to get stitches, lidocaine numbs up the area so you can get your stitches.
Okay. Got it. And so prolotherapy is very safe, 98% success rate. You mentioned that you shouldn't ice it and you should actually embrace inflammation, acute inflammation.
Right.
Can you kind of talk a little bit more about that? That was interesting.
Yeah, sure. So, if you were to sprain your ankle, you're going to undergo a normal reaction to that ankle sprain. There's going to be, in the first 72 hours or so, you're going to have the inflammatory phase, and part of your immune system is going to migrate into this area. And specifically what we're looking at with this, with the healing in regards to collagen, is a cell called a fibroblast. fibroblasts create collagen. That's part of what they do. So these cells will migrate into the tissues. We'll have a whole host of inflammatory chemicals come in. That's where we see that the redness and the swelling and all of those things that go along with that ankle pain and swelling that we see with an ankle sprain.
Yeah.
And so that initial phase is that first 72 hours after an injury. Then we have the second phase is called the proliferative phase. And that's where you're actually making new collagen. You're trying to strengthen these tissues. And that occurs over about a 6-week period after the injury. And then the last phase is the remodeling phase, and where the collagen, these fibroblasts, it's not like they're laying down railroad tracks where they take a piece of collagen and attach it. And it's this linear fashion. They're basically just kind of puking up collagen. So they just kind of spit it out. And then over that 18-month period, we're integrating that into the tissues, and we're orienting them in the structure that they need to be so that we get the maximum strength.
So the fiberglass giving out the collagen, do they do that with just one session, or is this something you have to continue doing?
Yeah, so they'll do that after a normal injury. That's why, that 6-week mark, that helps explain why a lot of people with low back pain will get better on their own in 6 weeks.
Huh.
You sprain your ankle, a lot of times it gets better on its own within 6 weeks.
Yeah.
So that's an interesting mark for, healing on our own and with prolotherapy. So anytime there's an injury, anything that stimulates that inflammatory response, you're going to have those fibroblasts migrate into the area, and they're going to begin to produce collagen. Because ligaments and tendons do not have a good blood supply, there's only a certain amount of healing that they can do. Sometimes it's sufficient, and the pain will go away. You'll return to normal function. But a lot of times we'll get, of course, I'm a little bit biased because I see patients that they didn't get better by traditional methods. And so we'll have continued and can be long-term pain. And with prolotherapy, we're re-stimulating that normal inflammatory response, trying to achieve the goal of full function without pain.
Have you seen back pain go away? Because I know the L4, L5 is like the most common site of back pain. It's one of the biggest complaints in the medical field is lower back pain. What have you seen prolotherapy do for people who are suffering from back pain?
Well, throughout history, back into the 1950s, and Dr. Hackett started in the 1930s with his case series. But since that time, we've got a greater than 85% success rate in treating musculoskeletal pain and problems. So, and that includes low back pain. And we have seen tremendous results with many, many cases of low back pain. In fact, since I've been doing prolotherapy, started in 2008, I have seen only one case of true sciatica where there was actually a nerve root impingement. The disc was herniated, pushing on the nerve root, causing pain going down the leg. Time after time after time, patients will come in and they'll say, I've got pain going down my leg, and they'll think that's a herniated disc pushing on the nerve. My experience, most of the time, it's a ligament or tendon causing radiating pain going down the leg. And one of the beautiful things about prolotherapy is that I can identify exactly where the damaged structures are because of the solutions that we use and the nature in which we do these injections. I would argue it's much, much, much better than an MRI.
My dad he thought he had the sciatic nerve, and so he went in for a few, hydrocortisone injections, and then I don't know if they fused it together to get rid of the back pain, but it was to the point, he was a swimmer 5 times a week, very competitive, and he couldn't do it anymore. It just was too painful. He'd walk around, like holding his back, and then he got, I think, the surgery, and it was all better. So the prolotherapy, how is it different than like the hydrocortisone injections?
It's as different as hydrocortisone as day is to night. It's the complete opposite end of the spectrum. Hydrocortisone, any of the steroids or any of the glucocorticoids are anti-inflammatory. We're trying to reduce inflammation in the hopes that we're going to minimize their symptoms. The problem is those medications are necrotic to the tissue. They destroy the tissue. And we know this. It's in every orthopedics textbook. We know that those solutions are damaging to the tissue. It's why you can only have so many of them so often.
Yeah, it's like 2 or 3 or something.
Exactly. So, and we can't inject them. If you've got an Achilles tendon problem, we do not inject steroids into the Achilles tendon because you can actually destroy or rupture that tendon after having a corticosteroid injection. So those are reducing inflammation and causing long-term destruction of the tissues, whereas prolotherapy is causing inflammation, enhancing the tissues. In fact, they've done animal studies where they did prolotherapy injections, dextrose prolotherapy injections, and the tendon, when they euthanized the animal at the end of the study and they evaluated the tendon, and it was 40% thicker than the control group, and it was 50% stronger than the control group. So we're making the tendons like bionic tendons. We're making them thicker and stronger than they were before the injury.
Why aren't more people talking about this? Is it starting to come around? Because it's the first time I've heard of it, and I did an exercise science undergrad, so of course I know everything, right? But we have people on the show all the time, and it's the first time I'm hearing about it. Is it still pretty underground?
Yeah, I would say that it is, and there's a couple of reasons why it is. The first one is most of my colleagues will evaluate, does something work or not, based on the scientific evidence. So what's the study proving that it works? And unfortunately, many of them will not use an intervention unless there's a study proving that it works. My argument from a functional medicine perspective across the board is I don't necessarily need a study to prove it works. I need to make sure that I'm not causing harm. That's my biggest issue. Don't do any harm. That's the first dictum of medicine. So as long as I'm not doing harm and there is potential benefit, then that's a therapy that I would consider. So so how do you get scientific studies? Well, they're expensive to do. You have to have funding. The solutions are very, very simple, and there's no money to be made in these solutions. So no one is, from a pharmaceutical perspective, is going to do a study on dextrose prolotherapy. So there aren't many studies proving that it works. In an environment where you have to have evidence-based medicine to convince people that this works, there's just not enough of that. Now, the second piece, so the first one is a lack of good scientific data. The second piece is the studies that are out there are very conflicted. And there's if I can take a step back and I'll tell the story about when I first started doing prolotherapy, I saw tremendous benefit. And I was an evidence-based medicine guy. In fact, when I was in residency, I was the resident in charge of evidence-based medicine. That was kind of how I thought. And that was a big reason why I shifted into functional medicine when I saw prolotherapy. So I did the injections on people, and they were getting better left and right. I mean, almost 100% of the time. I was like, this is amazing. Nothing that I do in medicine is this effective. So I started looking into the research, and I said, if I'm going to do stuff like this, then I better know what the research says and be able to defend my position and things like that. So the first thing I looked at was the Cochrane collaboration. And if your listeners are unfamiliar with the Cochrane collaboration, they're a group that evaluates the scientific evidence, and then they'll look at the quality of the studies and what kind of studies are out there, and then they'll make a recommendation. This works or it doesn't.
Are they kind of like skeptics, and they're going through everything and seeing if it's yay or nay?
Yeah, exactly. Yeah. So they looked at 5 studies on prolotherapy, and their conclusion was that it didn't work. So I've got a problem. I see that it works because my patients got better, like almost all of them. And now I have a study that shows that it doesn't work. This doesn't match. We've got a real problem here. So I pulled all 5 of the studies that the Cochrane collaboration reviewed, and I started reading the actual study that they looked at. The largest study was done by a physician out of Australia named Yelland. And I think this will underscore the point of why they came to their conclusion. The study had, I think it was 110 patients, and they had 2 groups. It was a randomized, placebo-controlled, double-blinded study, which would be the gold standard from an evidence-based medicine perspective. And neither the physicians nor the patients knew, were they getting saline injections or were they getting dextrose prolotherapy injections. So 2 different groups. One got saline injections. One got dextrose prolotherapy injections. And at the end of the study, they said that there was no statistically significant difference between the 2 groups. So from their perspective, this was no better than, quote, placebo, so it doesn't work. That was their conclusion. Now, there's a couple of problems with that. The first one is that you've heard of dry needling.
No.
Okay. very common in physical therapy. Dry needling is where you take a needle and you inject it into the tissue. And there are studies validating the effectiveness of dry needling. Again,
like placebo, sugar pill.
Exactly. So, and now with dry needling, there is a physiologic effect. It's not a placebo. So we know that there's an effect with that. So if we are doing an injection, we're sticking a needle into the tissues and we're injecting saline, we're thinking that that's a placebo. The problem is we know just sticking a needle into the tissue causes a change, and there's an impact with that patient. There is an outcome with that patient. So then when you inject any solution, you can cause an inflammatory response. So in effect, we're evaluating two different therapies.
Okay, because even the saline would cause the inflammation, which could cause a similar effect as the prolotherapy.
That's correct.
Since that's the mechanism for the healing.
Exactly. Okay. Now, at the end of the study, the thing that really drove this home for me was the average duration of pain of patients enrolled in the study was 14 years. They had 14 years of pain on average. At the end of the study, both patients were very happy. Both groups were very happy with their results. So both patients got better. A better conclusion, instead of saying prolotherapy doesn't work, a better conclusion is saline is as effective as prolotherapy because these patients got better.
Right.
So that's one of the many reasons why that study does not disprove prolotherapy, and I would argue that it is showing the additional benefit. And there were a lot of other things. When you look at the procedure, they limited the procedure to 10 milliliters of solution. I might use 100 in a low back. So it's a very different procedure than what I do, but regardless, they got better.
Yeah, that's interesting too, because the dry needle, if that stimulates somewhat of an effect versus saline, it's two different things, like you were saying. I think the number one thing people would be skeptical about at home is it safe thing. And, when they hear needles and injections, they immediately go to like Jason Bourne in a chair getting injected with like truth serum or something.
Right.
So the actual mixture is relatively safe and used on a everyday basis, right? It's just dextrose, the lidocaine, and then was it water?
Yep.
Okay.
Sterile water.
Okay.
Yeah, exactly. And to go to your point about is it safe? The former Surgeon General of the United States under President Reagan, so we're talking in the 80s, his name was C. Everett Koop, and he was actually an advocate for prolotherapy, and his statement was, the nice thing about prolotherapy, if properly done, is that it cannot do any harm. So the whole risk of the procedure itself is related to the needle and the injections. The needles that we use are very thin. So I use the biggest needle that I use is a 22 gauge in diameter, which is a relatively small needle, and I'll use a 25 gauge needle for a lot of things. And I'll even go as small as a 30 gauge for some others. So a 30 gauge needle is like a hair. I mean, it is a little bitty needle. So most of the time it's fairly well tolerated. I do offer sedation or medications to kind of calm patients down. I would say 98 to 99% of my patients don't need anything, and
I'd take it. It's free medication. Exactly. Have a good time while you're giving me prolotherapy,
exactly.
Dr. Chad.
And obviously, we want our patients to have a good experience when they come to see us, but our ultimate goal is that they get better. And I'm balancing. When you take a medication like Valium or Versed or fentanyl or one of these kinds of medications, you're going to be knocked out for a few hours. I mean, you may be awake, but you're not productive.
Yeah.
A lot of my patients will come in and get prolotherapy in the morning and then go right to work. So there's no downtime with this. Many of my athletes are working out the next day, not at their highest level, but I want that movement. I want motion because that helps with the circulation, which ultimately helps with the healing. So I don't generally give medications, although we can. I mean, I've got some patients that need it, and we can do that.
And I forget, was it an ongoing treatment or is it just a one and done kind of thing?
It's all really guided by the patient. Now, on average, the average patient needs between 3 and 6 rounds of the prolotherapy procedure in order to achieve that goal of full function without pain.
Is that spread out in the 6 weeks?
I reevaluate every 4 weeks because when you look at the way that collagen's produced, we want to maximize that collagen production. So I reevaluate between 3 and 4 weeks, and then we'll repeat the procedure at that time. And the average patient 3 to 4 weeks. So we're looking at 3 to 6 procedures. So we're looking at on average 3 to 6 months, and they're back to their normal baseline without pain.
Where would you recommend people go to find like a prolotherapy in their area if they have back pain or shin splints or anything like that?
Yeah, and that's a really good question because there is no, quote, certification for prolotherapy. Any physician can hang up a shingle outside their clinic and say, I do prolotherapy. And I've seen some really talented prolotherapists, and I've seen some really, really shady prolotherapists.
Can you do it? Can you do it yourself?
I actually do it myself.
Yeah, it's probably a learning curve. Not the safest thing, sticking 30 gauge needles into you by yourself.
Yeah, exactly. So to answer your question, and I strongly recommend that patients do something like this. There's an organization called the Hackett-Hemwall Foundation, and it's hacketthemwall.org. If you want to put that in the show notes or whatever.
Yeah.
hacketthemwall.org and go to the list of prolotherapists.
Okay.
The Hackett-Hemwall Foundation has probably the most rigorous training requirements of any organization out there. You have to spend a significant amount of time one-on-one with a trained prolotherapist in order to be on the list of recommended prolotherapists. So I'm the only one in Oklahoma, and
you got a monopoly on it.
Exactly.
Don't you get certified in Oklahoma, people?
Exactly. But I think that's probably the best place to start because you just don't know.
Yeah.
Another organization would be the American Osteopathic Association. No. American Orthopedic Association, the AOA, and they also do a lot of training on prolotherapy. And a lot of the people in the Hackett-Hemwall Foundation are also in the I'm sorry, it's AAOM, American Academy of Orthopedic Medicine. There we go.
Okay. Yeah, it sounds pretty safe just hearing it for the first time. I mean, just that mixture alone. I mean, like aspirin's probably got more chemicals in it, or even some of the things that are legal in like a drugstore. You go to over-the-counter medicines, and or supplements. You can order bioidenticals online and just start dosing yourself DIY. But when all of a sudden when you break out like needles, people freak out and throw their hands in the air, even though it might be less dangerous than some of the stuff that comes in like a pill form. Sure.
Yeah, I mean, it's incredibly safe. The last serious side effects that we saw were literally in 1956. So, a long time ago. It's very, very safe. I've done thousands of procedures, and I've never seen a single complication, even a mild complication. We just don't see them. We're very careful with how we do the procedure. And we make sure we get good follow-up and patients are taken care of in that acute phase. And we get incredible results.
Have you heard of stem cell therapy?
Absolutely.
Okay. Yeah. Is that similar, different?
It's very similar, but so I would argue that there's 3 basically phases. So you got prolotherapy. We're injecting these solutions that we've talked about. There's also PRP, or platelet-rich plasma therapy. Mm-hmm. And so have you heard of PRP?
No.
Okay. So names like Kobe Bryant. I mean, there's been several.
Is that where they spin it in a centrifuge and then they inject it back in?
Yeah, that's exactly right. So basically, and the concept is the exact same as prolotherapy. We're just using the growth factors that are derived from platelets to stimulate that inflammation, and it's very effective. It's a little bit more expensive, but we'll draw the patient's blood, spin it down in the centrifuge, and we'll draw out just that platelet-rich plasma portion. So, very effective. It's a little more potent than prolotherapy, but it costs a little bit more. Average patient who needs between 2 and 4 rounds. So PRP is also a great way to go.
Okay.
Then the last step that I would consider would be stem cell. And, there's several different ways that you can harvest stem cell. You can use adipose tissue or the fat tissue and go in and get the stem cells from there. You can do a bone marrow aspirate, or what we call a BMAC, and you can get stem cells from that. And those are autologous, meaning they come from the patient. And then you can also use a donor stem cell. And the one that I use is out of the tissue bank from the University of Miami. And they're using amniotic stem cell. Lower cost, very effective, very good. So I give the patient the option and let them choose. but so we do stem cell as well. And I usually guide patients to do stem cell if we're having knee or hip problems inside the joint and we're trying to regenerate cartilage. They're bone on bone, they've got a lot of knee pain and they're just not responding, then I would look at stem cell for that. But I almost always do it in conjunction with PRP and or prolotherapy.
It's kind of a good breakdown. It's like beginning, middle, and last resort.
Yeah, exactly.
Yeah, and probably cost too. I mean, prolotherapy is probably cheaper.
It's much cheaper. I mean, you're looking at, depending on the area. In our clinic, we charge by the area, but because it's based on complexity, how much solution we're using, safety, all those things. So anywhere from $150 to $500, depending on the region.
Wow, yeah, that's not bad at all.
Right, and that is per treatment. So 3 to 6 rounds. I mean, you're talking for like low back, $1,500.
Yeah.
Now stem cell, I incorporate PRP, the platelet-rich plasma therapy, and I use a higher volume, and so on the amniotic, and that. You're looking at a little less than $3,000 for that, and that's for a one-time deal. But stem cell is you do one procedure and that's it.
I mean, just seeing my dad walk around with that pain when I was growing up, just like clenching his back and just couldn't do anything.
Right.
It seems like a investment to get rid of that. That's what he was saying. He tried acupuncture, he tried anti-inflammatories, he tried medications, he tried icing it, he tried elevating it, different kinds of beds. Yeah, so. Okay, so prolotherapy, who would benefit from this? What are some of the most common conditions for the people out there? We mentioned shin splints, back pain. Are there any others?
Yeah, pretty much everywhere from the base of the skull down, I can inject. So, and it runs the spectrum. So I've done prolotherapy for migraines because there's often a musculoskeletal component to that. Neck pain, car accident where they had whiplash. I've had shoulder is the number one area that we do. See a lot of CrossFit athletes, whether or not they're doing their techniques correct or incorrect. And we've got some very talented CrossFit athletes, and we've resolved their shoulder issues. And our success rate with shoulders, like I said earlier, is about 98%. I mean, it's really effective. We've done wrists, things like carpal tunnel syndrome, lots of lateral and medial epicondylitis or tennis elbow and golfer's elbow, lots of knees, hips, ankles. In fact, I was a little late getting on the podcast because I was actually doing an ankle, and it was a very atypical ankle. It wasn't kind of your normal sprained ankle. It was just atypical, and so you just have to work through them, figure out where are they hurting, and go for the area that's probably causing their pain. So pretty much anywhere from here down. Okay,
fascinating stuff. And then, so if someone's experiencing, let's say they just got some back pain, like me on the drive. I went to Yellowstone last week, 16 hours. From Seattle to Yellowstone, and my back was just screaming by the end of it. I couldn't drive. I was hunched over and everything. And my first go-to was to ice it and take some ibuprofen or something like that. Maybe do some foam rolling. What would you recommend to me in that situation?
So I would everything that you did except for the ibuprofen. Remember that ibuprofen. They've done, again, animal studies where they cut halfway through the tendon and gave different animals, I think it was a rat study, that gave different anti-inflammatories to a series of these animals. And at the end of the study, the groups that got anti-inflammatories didn't heal. The group they left alone healed very well. So I would argue, based on those animal studies and what we see clinically, that by taking anti-inflammatories, you're inhibiting the healing process. They help in the short term, but they don't help heal those tissues. But I think foam rolling, stretching, massage, chiropractic, all of those kinds of things I think are a great way to go. And remember that a lot of things will heal on their own within 6 weeks. So if this is a recurrent or repetitive issue, you're not getting the benefit, and I would consider prolotherapy at that point.
Are there any supplements like fish oil? I know that one gets a big, like the lubricating of joints for omega-3s and stuff that you've seen work?
Working for the joints, no. Not specifically not fish oil. Now, I'm a big advocate for fish oil because of a multitude of issues. It is relatively anti-inflammatory. It's not an anti-inflammatory like Motrin. So I don't recommend that my patients stop their fish oil, like I would recommend they stop Motrin, because there's a lot of benefit to that. Balancing inflammation is probably a better way of saying it. Some of the natural anti-inflammatories like turmeric, curcumin, those kinds of things may not be a bad idea. Boswellia may not be a bad idea. There's some question about things like MSM, glucosamine chondroitin. They may be of benefit.
Is MSM the horse cream?
That's the methyl.
I think Joel Salamo was talking to me on the show. He buys like a tub of anti-inflammatory horse cream or something made for horses, and it was MSM or something like that. I don't know. Anyway, sorry to get you off.
I don't know. But so there's some things, again, going back to that, what's the risk? What's the potential benefit? So it may not be proven to work, but if we're not hurting somebody, then go for it. Maybe it helps them, and maybe it's just a placebo. Maybe they just think it helps, but who cares?
Yeah.
If they're better, then who cares?
Yeah, because the person at home might be a little confused. Here we are in the paleo community, whole food community, talking about anti-inflammatory this. You can't get inflammation, cause heart disease, and then in very specific areas with prolotherapy, inflammation is beneficial. And you want inflammation in specific areas because it's part of the healing process.
Right. And in that acute phase, when it goes, beyond 6 weeks and you've got chronic repetitive inflammation, that's a problem.
Okay.
Without question.
Okay. Well, cool. Couple more questions for you, Chad, before we let you go. This is a fun one. Flew by. These are our closing bits here.
Yeah.
The first one is looking back on 2016, 2015. What's been the biggest lesson you've learned?
Oh, goodness. Well, the first one, it's almost really more of a life lesson than anything else, but never, ever quit. Never, ever quit. Long story on, and I won't go into the details of this, but just, in my clinic, we faced a number of issues, and I had some staff turnover and things like that. And, you just nose to the grindstone, just keep working. And, I'm a big Dave Ramsey fan, and I was watching one of his videos the other day in Financial Peace University, and he was talking about this billionaire that read a book to his grandkids, and the book was The Tortoise and the Hare. And he says, every time I win it, or every time I read it, the tortoise wins every time. Yeah. So, it's keeping, hold true to what your goals are and just stick your nose to the grindstone. That's probably the biggest thing. Were you looking for specifically a medically?
No, that's perfect, man. Though I'd say 9 times out of 10 on the show, that's the way they go. It's out of the medical zone.
Cool.
What sort of books or resources do you use, recommend? What are your go-to favorite things?
Oh, gosh. There's a list. Right now, I'm currently reading The Omnivore's Dilemma. Great book. It goes into, just the history of the industrialization of our food. So that one I love. Of course, you can't ever go wrong with The Paleo Solution by Rob Wolf. Love that one. I do a lot with Wheat Belly. There's a book by Horowitz, Why Can't I Get Better? And it's like the story of Lyme and chronic disease. That one is just a wealth of physiology and why do patients get screwed up. So that's a really good book. So medically, those are probably the big ones.
Okay, great. And the last one, what have you changed your mind on in the past year?
Oh, goodness. Well, I recently started working in the emergency room again. And so, I like to keep my hat in that game as well. There's just a lot of benefit to, you want to keep keep a nice razor's edge on all of my medical skills, and functional medicine is certainly one of them, but it's very different than, traditional acute care medicine.
Yeah.
So the number one thing probably that I've changed my mind on is there are a lot of patients that come into the emergency room that they may not have health insurance. They may not have access to health care. And I used to think, go look it up on the internet. I mean, they just come in for some of the dumbest things. I'm being honest. They just come in for some things that you're like, this is not an emergency. And I used to get irritated with them. And now I just view it as my job is to take care of that patient in the best way that I can. They aren't as educated on this as I am. So, you know what, I'm getting paid to take care of them. Let's do the absolute best job that we can, and just treat them as I would want to be treated, regardless of of their background. So used to get irritated with them. Now let's just do the best we can to take care of them.
It's a good one, because I think being in the health community for, I don't know, a decade now, and getting educated on symptoms and how to and nutrition and everything. I'm not perfect. I still have so much to learn, and that's why I love doing the show. But anyway, when you don't have that information, health seems kind of daunting and scary. And when you get a headache, you might freak out and think you have something more serious like cancer. And so you go to WebMD and type in your symptoms, and then it tells you you're pregnant. And it's like, that's impossible.
Right.
And so you can go down that spiral for simple things. And I think it's normal for people when they're starting out, or maybe they're not as educated as people listening to this call, because a lot of people are smart on this, to really put out the information and just be gentle and educate people. And it's a learning curve with health, just like anything.
Yeah, there's no question. And so often I see my colleagues getting bogged down in illness and disease. And if we would do a whole paradigm shift across, quote, healthcare, which isn't, as you and I both know, is not healthcare, it's sick care. If we would shift toward taking care of someone's health and illness are mutually exclusive. You can't have both of them. If you're sick, you can't be healthy. If you're healthy, you're not sick.
Yeah.
So focus on health. You won't have to worry about illness and disease as much.
Dr. Chad Edwards, my man, our time has come to a close. Revolution Health and Wellness, is that the best place to find you at?
Yeah, that's for our clinic. I've got a podcast at againstthegrainpodcast.com. So that would be another one.
Is that on iTunes as well?
It is.
Okay. Against the Grain Podcast. Is that with Dr. Peter Osborne?
No.
Okay.
That's me.
Okay, I forget. Anyway, another story for another time.
All good.
Thanks for coming on, man. I really appreciate it.
Thanks so much for having me. I appreciate it.
That's Dr. Chad Edwards, everyone. Fascinating stuff with prolotherapy, things we've never talked about on the show before. IV replacement therapy as well. So I'm sure you can Google that and find clinics in your area if you're interested in that. Of course, no medical advice is being solicited over the internet. We don't play doctor over the internet. So always check with your healthcare professional before taking on anything we just talked about. So we've been doing the show now for 3 years. Thank you so much for supporting it. And the best way to support this show is to go over to iTunes, leave a rating and a review. It takes 3 minutes and helps us out a lot. So this week's on-air review, get your name read on air, is from Bass Player Babe. She says, great discussion of topics. Clark keeps conversation lively and easy to understand. Thank you so much, Bass Player Babe. Really means a lot. You took the time to rate and review the show. And we don't currently have any lined up. So if you want to be first in line to get your name on the air, your review read, head on over there. Again, it takes 3 minutes and it helps us out a lot. Be sure you go to PaleoHacks.com, get the show notes, get the archives, all our previous episodes over there. MyBestJournal.com. Again, that's my course I'm putting together on how you can use journaling to improve the quality of your life, self-growth, and something so simple, so cheap, and it's really just on how you use it. So that's the course I put together. All right, that's it. Thank you so much for listening. We will see you back here next Thursday with, Mike Mutzel. Going to be talking about the belly fat effect, hormones, and fitting your diet, the perfect diet, on just an index card. What does it say? That's it. Thanks so much for listening. See you next Thursday.